Hello and welcome to this episode in our series on neurodevelopmental disorders. In this episode, we will try to understand the importance of early intervention in children and individuals with neurodevelopmental disorders and how the parents can support in skill building. Come, let us meet our expert.
Intervention includes mainly two parts. One is assessment of the child to identify what problem the child has, and then comes management of the problems. And that includes mostly therapies, especially in children with neurodevelopmental disorders. And some of the children may also require medicines. So based on the plan that the treating team makes, they would advise the parents accordingly. Early intervention is crucial in neurodevelopmental disorders for three main reasons. Firstly, it allows for timely identification and management of developmental challenges. Nextly, it improves the outcomes overall. And finally, addressing the developmental challenges early on will help in preventing certain difficulties that are likely to arise during the course of the development, thereby promoting healthier development. Parents can observe the child's developmental milestones, and if they were to notice any delays in development or atypical behaviors, such as, for example, delay in acquiring speech or delay in motor development, like the baby not being able to turn over, sit, crawl, walk, etc., or difficulties with social interaction and communication, like child not responding to their name call or not making adequate eye contact, and or atypical behaviors such as repetitive behaviors that are coming in way of engaging in day-to-day activities. So if parents were to identify any such concerns with their baby, it's advised that they seek professional support to identify the problem and manage the same. So when parents take their children for interventions to professionals, we consider them as part of the treating team and in fact call them as co-therapists, because they are the primary caregivers and the child is with them. So in a naturalistic environment, they can help with building the skills of the child along with the treating team, who carry out sessions in a more structured environment in a hospital setting. Every child has their own strength and also interests. So it's very important for parents to identify a child's strength and also interests along with the challenges that they're facing. So it's important to set up goals or targets of intervention and use child's strengths and interests to be able to address the challenges. Besides this, there are simpler strategies such as making a structured routine and giving clear and specific instructions to the child, or prompting the child in case of motor difficulties, like holding the child's hand to be able to make the child do something, or giving verbal instructions and using praise and encouragement whenever the child does something new or different from the regular routine. So these simpler strategies can be incorporated in their routine to be able to help the child develop new skills. So the journey of parents is going to be like a roller coaster ride. While there are going to be some exciting phases when the child is learning something new, at the same time there may be lows when they may feel that they're stuck with helping the child out with something or unable to identify what the child is going through. So especially when they're in these low phases, it's important to maintain the patience, perseverance, and to be flexible and adapt the strategies for those moments or situations. And at the same time, when the child is doing better, they should also learn to celebrate those successes. So it keeps the parents going on with the journey that they have set on with their child. And at times that it gets overwhelming, it's always recommended that they seek professional support to be able to understand the behavior better and support the child. So for parents who are coming from remote areas, there are district early intervention centers available in many states of our country. The team there generally comprises of a pediatrician, a psychologist, therapists, and so on. And as required, they may refer the child for better help to higher centers in case they are not able to help out at district level. In metros, there are developmental pediatricians and child psychiatrists who can look into this area of neurodevelopmental disorders, and pediatric neurologists as well, who can advise accordingly.
This concludes the episode on interventions in neurodevelopmental disorders and the role of parents. In this episode, we understood the definition of interventions, why early intervention is crucial in neurodevelopmental disorders, how can the parents recognize the signs and contribute to the intervention, what is the role of parents in skill building, the strategies and challenges associated with skill building, and where to seek help. We'll be back with our next episode. Namaste.